Maria Holder Diabetes Center.
Diabetes doubles your risk of heart disease. Know your numbers today.
It's the 20th of September 2025 in the year of our Lord. And you're about to hear 15 diabetic friendly minutes on VOB being brought to you by the Barbados Diabetes Foundation.
So what am I about to hear today?
I passed that question on to Dr. Diane Brathwaite.
And today I'm going to review two things. Number one, we're just going to quickly review correct blood pressure measurements.
So if you ever wanted to know how to take your blood pressure properly, make sure and listen, because Dr. Diane Brathwaite will be dealing with that this morning. And the second thing she'll be dealing with, by the two gypsy. Listen and find out what it is.
So in order for schools to participate in these kind of activities and support, the staff need to be educated a little bit about diabetes.
Hear what diabetes specialist pediatrician Dr. Misha Lashley has to say about diabetes in schools. All this and more coming up.
I can't wait!
All with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank whose staff is waiting eagerly to help you achieve your financial goals, Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money, but members get 10% off.
A happy Saturday morning, dear Smooth and everybody on VOB. This is Peter Boyce here to remind you this morning what I hope you already know, that the Maria Holder Diabetes Center, located behind Uniskipsa Polyclinic in Warren, St. Michael, you know what that is?
You can find it on Google Maps.
Yes, that's the place you should be headed if you are diabetic or pre-diabetic. They have everything there that you need. They have a podiatry department with some lovely nurses to look after your feet, to keep your feet healthy. There's also vascular screening.
That's like if you have bad circulation.
Yes, or chronic venous insufficiency. You can also check for diabetic retinopathy with diabetic eye screening, something that once you are diabetic, you are supposed to do that every year. Or make an appointment with dietitian Victoria Cox to get your own personalized meal plan to help you achieve your health goals.
When I get my diet plan, I share it with nobody. They don't have Victoria to get it on.
Also, you can make an appointment to see diabetes specialists like Dr. Diane Brathwaite, who has been coming on this show every Saturday morning dealing with cardiovascular risk. But today, Dr. Brathwaite will be dealing with a topic that is related to that, so it's the same but different. We say good Saturday morning to Dr. D.
Hello, good morning. Wishing everybody who's listening a happy Saturday from those of us at the Barbados Diabetes Foundation. I hope you have had a great week as always, and I hope that you're going to plan to get a little bit of rest this weekend, of course with some activity, socialization, of course, you know that nice word we love, exercise. So we've been talking quite a lot about cardiovascular risk over the last two sessions, and today I'm going to review two things. Number one, we're just going to quickly review correct blood pressure measurements. This is something that we promised to come back to in one of our last posts. And remember, we want to be using something called an arm cuff. So that means that it's a cuff that goes on the arm in preference to a wrist cuff, right? So it's always good to have accurate blood pressures. And I would have mentioned on previous posts, I do actually recommend that each family have a reliable blood pressure machine. You can discuss with the pharmacist what some of the best machines are, and there are a number of distributors who sell very good validated machines in Barbados. Okay, so we do recommend doing home blood pressure checks because there are a number of people, especially people of color, who will have elevated blood pressures when they go to their doctor's office, something called white coat hypertension. Of course, if you're not able to do it at home, well then yes, you have to rely on doctor's readings, but we want you to be empowered and we want you to be able to take your home readings to your office visits with you. So I'm going to give you a quick checklist of some do's and don'ts to help you take your blood pressure more accurately. So we recommend that you don't eat or drink anything 30 minutes before you take your blood pressure. Make sure that your bladder is empty before you go to do the reading. So if you feel like you need to go to the washroom, go and empty your bladder before you check the blood pressure. Make sure that you're sitting comfortably in a chair with your back supported, and you should be resting for at least about 5 minutes before your reading. The arms should be resting at heart level height. So most people will have their arms maybe just resting on the side of the chair on a small table. Make sure you put both feet flat on the ground and keep your legs uncrossed. You also want to make sure that the blood pressure cuff is snug but not too tight, and the cuff should be against your bare skin and not over clothing. And of course, it makes sense, do not talk while your blood pressure is being measured. I also tell people, when you press that button to measure the blood pressure, don't sit there staring into the blood pressure machine looking at the numbers go up and down. That doesn't facilitate a state of relaxation. I also like to tell people, if you take a blood pressure reading, relax for a further 3 to 5 minutes and do a second reading. If the two readings are significantly different, you want to rest for a further 3 to 5 minutes, minding all the guides I've given you, including do not talk, and you want to do a third blood pressure reading. By the third blood pressure reading, you should have a pretty good idea of what the blood pressure is going to be. Sometimes if the two readings, the second and the third, are pretty similar, you can average out the top and the bottom number, but we generally tend to go with the lowest number. So those are your tips for Saturday on measuring the blood pressure. Do take good care of yourself, and remember, heart health is your health and your heart matters.
Thank you, Dr. D, for that information on how to take your blood pressure correctly and reminding people that their heart matters. But I should think that people out there listening should know that by now. I mean, after all, you need your heart to live. So make sure and do what the doctor says and keep your heart healthy. Something that you should never forget. Just like how you shouldn't forget that September is back to school. And if you have a child that is diabetic, you might want to know how they should be managed in the school system. So for this, we go to diabetes specialist pediatrician Dr. Michelle Lashley.
We think that education is probably one of the biggest things that we can help schools with, either through their social workers, their guidance counselors, or otherwise, or even in sometimes what the physicians or the caregivers will be encouraged to do, maybe to have sessions with maybe the parent-teacher associations, so that both staff as well as other parents will be aware of how these children who have a chronic illness will be managed throughout the school day. The school staff should be aware of the symptoms, as I said, of low blood sugars and how this should be managed. And even with older children who are independent and managing their care, they may still need some supervision of their mealtime and activities, because some, particularly an abnormal blood sugar, either very high or very low, will affect the child's ability to think clearly and to manage their condition appropriately. So the teachers really should be aware of what some of these symptoms look like, what kind of things they could be looking for in the school day. We also have to consider that the student has a right to full inclusion despite their diabetes, especially the adolescent. These older children and youth don't want to be singled out in a way that will make them feel embarrassed or have a stigma to make them look different, but they still want to participate in all activities that their peers may be doing. And the school should encourage this, giving these children and youth that safe space where they can manage their care, and the schools may then have to allow these children to have the use of maybe the sick bay, if there's one in the school, a school office area where they can manage their blood taking or managing their insulin administration, and even a counselor's office if needed, so that they can go without looking as if that they are slightly different or doing something different than the other peers. Unfortunately, because of the continual health care that's needed for any chronic illness, some students may have to attend regular health visits. And the other thing the school can do to help support these children is to make sure that they are allowed out during the school day if needed for their healthcare visit, and the school attendance policy should not penalize students if they have to have regular appointments when their diabetes care maybe need a little bit more intensive management. So in order for schools to participate in these kind of activities and support, as I said, the staff need to be educated a little bit about diabetes.
So we go from Dr. Michelle Lashley educating you about diabetes in schools to an educational song. As our Saturday song of the day, this is the Mighty Sparrow with an evergreen education. Compliments the Maria Holder Diabetes Center and Republic Bank.
Education, education, this is the foundation. Our rising population needs sound education to be recognized anywhere you go.
Maria Holder Diabetes Center.
Have your certificate to show, to enjoy any kind of happiness. Knowledge is the key to success. Children go to school and learn well. Otherwise, later on in life, you won't catch real hell. Without an education in your head, your whole life will be pure misery. You're better off dead. For there is simply no room in this whole wide world for an uneducated little boy or girl. Don't allow idle companions to lead you astray. To earn tomorrow, you got to learn today.
The Maria Holder Diabetes Center.
We now welcome a patient of the Maria Holder Diabetes Center, Mr. Paul Edwards.
I've been a patient of Maria Holder Diabetic Center for probably about 7 years now. To cut a long story short, I couldn't have done without them. Even when, the going was tough, Diane helped us with some, medicines and made sure that we all got, what we needed to keep going and to control our diabetes. This facility is top notch. But the long and short of it is, Barbados for many, many years has been known, and sadly, I'm sure that this reputation is getting a lot better. Has always been known as the amputation capital of the world, which is really sad. But with the help of everybody that works at the Diabetic Center, I think we've kind of moved a little bit forward from that now, because you can get help. I would advise anybody in Barbados who just thinks they may be a diabetic to go to the Diabetic Center. I have nothing but high praise for it.
In 2025, the Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening, vascular screening, and podiatry services, offers a standard of diabetic services that equals or surpasses any you might receive internationally at a price that everyone can afford. So if you are diabetic or pre-diabetic and listening to VOB right now, call and make an appointment to get your eye screened for diabetic retinopathy by calling 243-3937. Or if you are having vascular or circulation issues or need to see a podiatrist or nutritionist, call 417-0305. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center. Until next time,
Sugary drinks spike your blood sugar faster than anything else. Water is your best friend.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how to get your simple digital eye screening done for just $100.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you.
Holder Diabetes Center.